Exploring the Use of Mandala on Anxiety Reduction by Victoria Bradford, who is myself, and my project advisor, Dr. Joseph Green, a professor in the Department of Psychology at OSU Lima. Anxiety has a pretty high prevalence rate in the US. An estimated 31.1% of adults in the United States of America will experience an anxiety disorder at some point in their lives. Due to the high prevalence of anxiety and relative cost of treatment, researchers have sought low-cost behavioral activities that could alleviate anxiety without having to turn to medication or formal psychotherapy. Creating art by means of coloring, painting, or drawing have been shown to de-escalate self-reported levels of anxiety and elevate mood. However, the research on the therapeutic effect of creating art is limited and outcomes have been mixed. There are still reasons to believe that art production can have stress-reducing or relaxing effects. And more specifically, the work of Curry and Kosser and van der Verne and Cerise suggests that coloring an image of a mandala may have a uniquely soothing effect. So a mandala is made of geometric combinations of symbols within the design, and you can see one here on the slide. Young, in 1973, suggested that mandalas can be considered an archetype of wholeness, harmony, and balance. Curry and Kosser explored the possible benefit of coloring a mandala image to reduce anxiety among undergraduate students. After attempting to induce anxiety through a 4-minute writing exercise based on a time when participants felt most fearful, students were randomly assigned to color a mandala, a plaid design, or engage in free coloring on a blank piece of paper. Students' anxiety level was assessed via the State Anxiety Inventory at 3 time points: at the beginning of the study, after writing about a fearful event, and following the exercise. Those who colored the mandala or the plaid figure showed lower average anxiety ratings than their baseline measure and experienced a greater reduction of anxiety than those in the free color condition. In an attempt to replicate the work of Curry and Kosser, van der Venne and Cerise tested the effect of coloring on a self-reported anxiety levels using a similar design. They found that the coloring of the mandala produced the greatest reduction of anxiety relative to the other two conditions, the plaid or the free color. Furthermore, only the mandala coloring resulted in a statistically significant reduction in anxiety compared to baseline. Our study was designed to examine the effectiveness of coloring a mandala image on anxiety. At the beginning of the study, participants completed 2 brief measures of anxiety and personality to show that participants within our conditions had similar anxiety levels and personality characteristics before we began. At each time point, we use a single self-report measure, being, how anxious do you feel right now at this very moment in time? Responses were indicated on a scale of 0 to 10, 0 being not at all anxious, 10 being very anxious. Similar to past designs, we used a 4-minute writing exercise to induce anxiety. Post-anxiety induction, we randomly assigned participants to one of 4 conditions, each lasting 20 minutes. Those conditions being coloring a mandala, tracing a mandala, free coloring, or waiting, a control condition designed to simulate a waiting room experience. We included a tracing condition as a comparison to coloring the mandala because we wondered if activities involving the mandala, as opposed to specifically coloring it, were beneficial to relaxation. Additionally, we included a control condition to explore how anxiety levels might change across time. Similar to past work, we included a free coloring condition to assess whether coloring in and of itself is effective in reducing anxiety. We included an assessment midway through our condition to determine if a full 20 minutes were necessary or if we could see a reduction of anxiety in only 10 minutes. We also included an assessment after a 15-minute delay at the end of our study to explore whether the effects of our intervention lasted beyond the length of 20 minutes. And finally, at the end of our study, we administered a brief survey of our participants' attitudes towards coloring and tracing's effectiveness at reducing anxiety. We also asked if they used coloring as a relaxation technique when stressed, and if so, how often did they do so in a month's time? So our study was designed to answer the following inquiries. We do predict that momentary anxiety scores will be higher after the anxiety-producing exercise at time point 2 than at baseline, time point 1, for all conditions. This would indicate that our writing exercise worked. We predict that momentary anxiety at the end of the 20-minute intervention, time point 4, will be lower than the ratings taken after the writing exercise for all conditions because anxiety tends to dissipate over time. So we conducted a two-way mixed ANOVA to examine the pattern of self-reported anxiety levels differed by condition. We did not find a significant interaction between the intervention and time on self-reported anxiety levels. The main effective condition was also not significant, but as predicted, the main effective time was significant. So self-reporting anxiety ratings significantly changed across time. The pattern indicates that participants felt an increase of anxiety after the 4-minute writing exercise as we intended, as you can see that shown between time 1 and time 2. Then, a significant decrease was shown within the first 10 minutes of each condition, and a continued reduction of anxiety at the end of each condition. This pattern of evidence indicates that only 10 minutes of coloring, tracing, or waiting was necessary to observe a significant decrease in anxiety. Still, a greater reduction in anxiety was evident at the end of the 20-minute period between time points 3 and 4. Ratings of anxiety did not continue to decrease following the end of the intervention activity. This may be due to a floor effect, as ratings at time 4 were already very low. Ratings across our attitudinal survey did not differ by condition, with the exception of students in our color mandala condition who rated the tracing as being more effective to reduce anxiety than did students in our weight room condition. We were surprised to find this. It's unclear what this means or whether it's just a statistical anomaly, perhaps due to our relatively small sample size. We predicted that more women would report using coloring as a way to relax than men, and that they would report more frequently doing so in a month's time. Our data confirmed our predictions, as you can see here in the marked boxes. A significantly higher percentage of females reported using coloring when stressed, and at a significantly higher frequency within a month's time. Responses to our attitudinal questions on the effectiveness of coloring and tracing did not differ by gender. Our exploratory findings are tentative due to our limited sample size. We had approximately 30 students per condition, and breaking each condition down by gender would result in the number of students within each cell falling below 20, a minimum value often recommended by statisticians. A much larger sample would permit researchers to examine the role of gender within conditions. In addition, with a larger sample, researchers could break down the sample into individuals high or low in state and trait anxiety, or divide people on the basis of specific personality traits. Future studies may consider distributing our attitudinal survey before and after introducing the condition. This could reveal if pre-existing beliefs about the coloring and tracing have an effect on participants' experience of anxiety while coloring or tracing. In conclusion, our findings question the claim that coloring a mandala is uniquely associated with anxiety reduction.